Stephen Wade, thanks for your time this morning. Can we just confirm the latest numbers you have now for positive tests and suspected tests?
Our total in both confirmed cases and probable cases is 20. That's 17 members of the family, 2 security guards and 1 close contact of the family.
How do they all link together?
So the family obviously has both shares households and has close contact with each other. The 2 security guards worked at the Medi Hotel where one of the family members worked, and likewise the close contact was also a fellow workmate.
What critical work did you do around Medi Hotels yesterday to try to prevent this spreading further?
Yesterday, the regular testing of Medi Hotel workers was introduced. Routine testing has been available at Medi Hotels on an ongoing basis, and there are daily declarations of symptoms by Medi Hotel workers. But regular 7-day testing has been introduced at the Medi Hotels.
Do you expect?
I should indicate too, there's been.
No, you go.
I was just going to make clear that there's no evidence at this stage there's been a breach of protocols in relation to the Medi Hotels. We need to remember that COVID-19 is a highly infectious disease. Even highly trained health professionals with full PPE in an acute hospital environment have contracted the virus. Infections will occur. We just need to be ready to deal with them when they do occur, to make sure that a case doesn't become a cluster doesn't become an outbreak.
Yeah, well, let's just, before I ask you about broader restrictions, the advice is that it started at Medi Hotel. You say there was no breach. So how can you say that definitively?
Oh, the investigations are continuing, but the family member who worked at the Medi Hotel didn't have direct contact with residents. They were involved in back of house. We know that the COVID-19 can be transmitted through surface infections, and as I said, it's a highly infectious virus. We have, even in an acute hospital environment where highly trained professionals are using full PPE, viruses are still contracted. The investigations will continue, but we're constantly looking at ways to improve our Medi Hotel safety. We're the subject of a national review by Jane Halton in recent months. Gave South Australia a gold star, but of course we continue to look at opportunities to improve the safety.
Just quickly, last one on that. Are you taking up the offer for the Defence Force to help out?
Yes, indeed. We're already receiving help from Western Australia in terms of contact tracers, and we've greatly accepted the Prime Minister's offer of increased support. We've been working side by side with ADF for months now, particularly in terms of border controls and Medi Hotels. So we look forward to additional support in terms of contact tracing when and as that's required.
I suppose you were pleased with the turnout yesterday for testing. Are you satisfied that you have the capacity to test all of the people that you would like to see tested to try to prevent this cluster from expanding?
We were delighted with the turn up at testing clinics yesterday, and we're urging South Australians to maintain that vigilance. Even with the mildest of symptoms, we want people to get tested. In terms of SA Pathology and our public health team, we are blessed with a world-class team. We believe that we've got the capacity to ramp up as needed to meet the testing demand. We'd ask people to be patient. Obviously, with thousands of people going to get tested yesterday, there were delays, but we're working hard to make sure that we minimise those delays.
Why did you come to the restrictions around aged care to just 2 visitors a day? Why not go a bit further with restrictions during this critical time, this next 48 hours?
This is the second time that we've ramped up our restrictions, particularly in relation to aged care. The first ramping up was in relation to the Victorian second wave. Some of the measures that we've imposed as of midnight last night are reflective of that original set. We're the only state outside of Victoria that's restricted the capacity for aged care workers to work across sites. We're reintroducing masks. The visitor limitations are as minimal as they can be, because we know that it's very important for older people and their families to maintain contact, and visitors have been a relatively low source of infection in terms of aged care facilities.
Most of the rules around masks now that you were talking about yesterday and the Premier was mentioning is advice and not restrictions. Why not go a little harder on masks over the next week?
Masks are mandatory in aged care facilities where physical distancing can't be maintained, and the general advice in the community is for masks where physical distancing can't be maintained. We think that masks have a role to play, but as part of a range of measures, we've introduced both community-wide measures and, shall we say, targeted advice in relation to people who've been at particular locations.
Yeah.
These measures apply statewide. We believe that they're an appropriate ramping up in terms of, as we deal with a cluster, to minimise any potential community spread.
We're out of time. Just very briefly, are you sweating on more numbers coming to you this morning? Should we be standing by, or is 20 how it will stay for much of today?
We don't know what will come, but let's put it this way, we're very encouraged by the testing.
Yep. Stephen Wade, thank you for your time.